mentioned, we'll be and our objectives are clearly printed here. So by the end of this session, we hope that everyone will walk away with the ability to define the role and the value of a community health worker, identify key roles, responsibilities, and contributions, and also understand how the Hawaii Community Health Worker Association and the Hawaii Public Health Institute are supporting and uplifting CHWs throughout the state. So just kind of starting off with scratching the surface, kind of helping you folks to identify kind of who we are and what we do within communities. So who are community health workers? According to the American Public Health Association, community health workers are frontline public health workers who are trusted members and have an unusually close understanding of the communities that we serve. This trusting relationship really enables community health workers to serve as that link between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. CHWs also do a wide range of activities such as building individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and even advocacy. Now, it's also important for you folks to know that community health workers don't just go under the title of community health workers. Under the umbrella of community health workers, there's over 200 different titles throughout the nation. Some that we see familiar here in Hawaii are peer counselors, enrollment specialists, health educators, caseworkers, health workers, patient navigators, public health aides, case managers, community health outreach workers, health outreach workers, lay health advisors, health ambassadors, and many, many more. So till today, we're still trying to unite the workforce, making sure that everyone identifies under the CHW umbrella. Now, what do CHWs do? Our superpower is really building trusting relationships. Because we come from the communities that we serve, we understand the barriers as well as the success. We also understand the culture within our communities. This close understanding of our communities really allows us to build that trusting relationships because we understand what community members are going through. And oftentimes, community health workers have gone through those same barriers and same experiences. And that's what's really given us the ability to understand how to thrive within these environments. Once we build that trusting relationship, we have easy conversations about really what's those bottom line non-medical factors that are influencing their health outcomes. They also refer to that as the SDOH or the social determinants of health. And there are many social determinants of health, but some that we see common here in Hawaii is historical trauma, especially on the Native Hawaiian population and their mistrust with the Western systems. We also see social determinants of health around limited access, especially for our community members on rural islands such as Lanai that have to fly into Oahu to give birth to their babies. We also see a lot of environmental factors, such as my own living in Waipio Valley, having to travel up a steep road that is inaccessible at times, and also the volcano that's present here on the island that sometimes prevents people to get the medical care or social services that they need. We also see social determinants of health around low socioeconomic status or poverty. People not even be able to afford gas to get to the doctor's office or gas to get to the pharmacy, and having to work 24/7, two jobs, and not having the availability to get into the doctor's office that's usually open from Monday to Friday. And of course, we also see a lot of cultural barriers. A lot of the social determinants of health can't be done with a screen or a lab test, right? It is truly by building that trusting relationship where community members feel comfortable with really exposing themselves and their barriers that they currently experience. Now, what do we do with that? We build that community resilience because now that we have that trusting relationship, they can easier engage with medical care or the health services that they need. One thing that stood true with community health workers is that we're boots on the ground during the COVID-19 pandemic, doing treatment referrals, contact tracing, health education, needs assessments, and even translation services, making sure the community members were aware of the things that were happening. And the recent Maui fire as well, we were there, boots on the ground, identify as integral healthcare workers, really helping to navigate community health workers to referrals to social services and behavioral health services. We provided informal counseling, just giving them a call, checking in on them daily, and then provided outreach, meeting them where they're at, and engaging them with follow-up visits with their medical providers. And same was true during the federal shutdown. A lot of our community health workers were there navigating to food resources and different things, and also the SNAP freeze that took place. So very excited to see that CHWs is now elevated and really looked at as an integral partner in creating lasting changes here in Hawaii. We do have core competencies that's established in a national platform by the National C3 Council, and some of them are listed here. And it's also important for you folks to know that there is no certifications or licensure requirement here in the state of Hawaii. There are current education options available through the Hawaii Community College System for Community Health Worker Program, and this was provided statewide, and it's a hybrid program, usually online or in person, depending on the location, and the graduate will walk away with a certificate of competence. And then we also provide additional training through the Hawaii Community Health Worker Association Lunch and Learns and other training opportunities through the association. So now that you know who we are and kind of what we do into communities, I'd love to pass it on to Sid Hoffeld to share a little bit about her role as a community health worker in the field working for a federally qualified health center. Thank you, Sid.
Thank you so much, Chauncey. So Chauncey, is it okay that I ask you to go to each? Okay, perfect. Thank you. So as Chauncey mentioned and Kiana mentioned, aloha, my name is Sid Hoffeld. I'm the Community Health Educator and Community Health Worker Supervisor for the Hawaii Island Community Health Center. We are an organization dedicated to the well-being of our island ohana. Our mission is clear and powerful. We promote lifelong health and wellness through quality healthcare that is clear and that is comprehensive, integrated, culturally responsive, and accessible to all. By anchoring ourselves to this purpose, we bridge critical gaps to ensure that no one goes without the medical, dental, or behavioral health support they need. Through these photos, you can witness that our center directly demonstrates its commitment to community wellness by providing free health information and screening across the island. These zero cost events serve as critical safety nets, ensuring that financial barriers never stand between our community and preventive care. By bringing these screenings directly into local venues like health fairs, coffee farm outreach, and kupuna resource fairs, we make it simple and accessible for individuals to take care of their health from before small symptoms turn into serious medical issues. The primary power of these screenings lies in early detection and seamless intervention. They allow our outreach team to identify hidden health issues such as high blood pressure and diabetes. Once a risk factor is flagged, our CHWs can connect them to comprehensive health, dental, and behavioral health care they need within our network, or provide them with critical information to share with their primary care providers. This proactive approach saves lives by interrupting chronic disease development at the earliest possible stages. Next slide, please. Thank you. As a federally qualified health center, or FQHC, we operate under specific federal mandates to serve underserved rural regions, providing high quality care to everyone regardless of their financial status or ability to pay. This vital designation secures the essential federal funding and resources needed to sustain our comprehensive integrated healthcare services. Rather than focusing on profits, our FQHC status ensures that every resource is poured directly back into community health and wellness programs and services. The importance of CHWs and FQHCs is at the very heart of this mission are our community health workers. These dedicated professionals drive our outreach successes by acting as the ultimate bridge between clinic resources and local neighborhoods. By navigating cultural nuances and building deep personal trust where it matters most, our CHWs ensure that healthcare moves beyond our clinic walls and straight into the lives of the people who need it most. Let us examine the critical role of community health workers within federally qualified health centers, or FQHCs. By definition, FQHCs are federally funded, community-based nonprofit health centers that receive federal grants to provide comprehensive primary care services in underserved rural areas and to vulnerable populations. Within this structured ecosystem, CHWs have earned widespread national recognition for their immense values. This offers unique services and deep cultural insights that clinical staff simply cannot replicate, strictly due to their incredibly close personal ties to the communities. Because they belong to and share the lived experience of the populations they serve, CHWs create more effective, trusted linkages between patients and medical providers. They serve as as a vital bridge, translating clinical care plans into realistic everyday steps. Beyond clinical support, CHWs provide essential health education, informal counseling, and fierce patient advocacy to help individuals confidently navigate a sometimes confusing and fragmented healthcare system. By addressing these basic human needs, we directly target the social determinants of health and dramatically improve long-term health outcomes. To visualize this impact in action, consider a common scenario. A CHW might sit at a kitchen table to help a patient fully understand their new MedQuest requirements, preventing the loss of of insurance coverage that could lead to emergency hospital or urgent care visits instead of annual wellness checks. In the very same afternoon, that same worker might connect another struggling family to local emergency food resources or housing assistance. It is through these dedicated, holistic actions that our community health workers truly bring the mission of an FQHC to life and ensure that no patient or community member slips through the cracks. Next slide, please. Nice. Excellent. Thank you. The healthcare landscape is undergoing a massive shift from traditional fee-for-service models to value-based care, which prioritizes patient outcomes over the value or the volume of service delivered. This new paradigm increases the demand for highly efficient provider encounters, requiring robust patient education before individuals even step into our clinics. To meet these demands, community health workers play a pivotal role by directly addressing the social determinants of health, such as housing, food insecurities, and employment that heavily impact clinical outcomes. They deliver immense value-added services through cross-team collaboration, patient-centered care, preventive health screenings, chronic disease prevention and management, tobacco cessation, and nutrition counseling. For instance, a CHW might lead a community nutrition class or personally guide a patient through a complex enrollment process for health insurance coverage and public assistance programs like SNAP benefits and ensure holistic wellness. Next slide, please. Community health workers carry out several core roles to uplift our community, acting as patient clinic liaisons, helping individuals navigate complex resources, promote healthy behaviors, advocate for patient rights, and delivering direct services. These roles come to life through specialized programs tailored to our island's specific needs, including the Marshallese Diabetes Program, tobacco cessation and treatment, street medicine, street outreach, kupuna outreach, and targeted health education. These initiatives directly break down deep-rooted barriers to care and vastly improve healthcare access for our most vulnerable populations. For example, our street outreach and street medicine programs meet people exactly where they are, bringing vital healthcare services directly to unhoused individuals who might otherwise never step foot inside a traditional clinic. Next slide, please. Despite their proven value, community health workers face significant challenges today, including severe funding limitations driven by changes to Medicare, critical staffing shortages, and recruitment and retention hurdles that hinder network growth. However, these challenges open vital opportunities to formalize the profession through standardized training and state certification while building a unified coalition like the Hawaii Community Workers Association. We can secure sustainable funding by collaborating through professional conferences like the one we just hosted last week Friday at the Ko'olau Ballroom, and advocate for policies that thank you, that explicitly recognize CHW services. I encourage everyone in attendance today to consider how you can actively support our community health workers and advocate for their essential permanent role within the future of healthcare. Thank you. And with that, I'll pass it back to Chauncey or Rosie. Yeah.
Thank you for that. And thank you so much for sharing some of your work with the federally qualified health centers. And hopefully you folks have a little bit of more of an understanding how integral and valuable CHWs is within the FQHCs. We also find them in different work sectors such as CBOs, in pharmacies, with insurance companies, with the Department of Health, and hopefully expanded to public health nursing here in the near future. So excited to see the future of community health worker workforce and share with you some of the ways that the Hawaii Community Health Worker Association is uplifting this workforce. So first of all, the association was established back in 2022, but we've been doing a lot of work since 2002. And finally, in 22, we were fully established with a full-blown leadership council. So this is our leadership council for our next leadership term from 2026 to 2028. All of our leadership councils are CHWs themselves and represent different work sectors. Gracie Flores works for United Healthcare. Sid, of course, works for the Federally Qualified Health Center, the Hawaii Island Community Health Center. David Mamai works for a community-based organization, Pear Suites. Crystal Kadai-Bergayo is in DOH, and Denise Olaropa works for the Office of Aging. So very excited to see them bring that wealth of understanding of some of the barriers into the actual Leadership Council. And similar to CHWs within the Leadership Council, we also have 2 island reps. Each island is so geographically different and they have their own barriers. So it's so very important that we bring in those perspectives of CHWs from those islands. And very proud to say that our Leadership Council is 100% CHWs kind of leading the way and really being a self-determining workforce. They work together to uplift our mission and is really to empower and equip community health workers to reduce health disparities by increasing access to training, education, and multi-sector collaboration. And we envision that community health workers are recognized as integral partners to creating lasting changes to healthier communities in Hawaii. Some of the things that we're working on strategically is really building the capacity and professional development of the workforce, making sure that we're collaborating and networking not with just CHWs, but also CHW allies that are interested in uplifting the workforce as well. And also education campaign, because still today, we find a lot of people still asking, what is a CHW and what do they do within community? And of course, policy and advocacy, making sure that CHWs are at the table when things are planned out and not implemented. Some of the things that help us to achieve those goals is by us providing monthly CHW only meetings. We provide this once a month for CHWs on the third Thursdays, and a place where CHWs can connect, network, learn, and share. We oftentimes have guest speakers sharing some of their resources that are available, and basically a space where CHWs can come together and learn and grow together. These CHW meetings are also recorded because we understand that CHWs are boots on the ground and are always available to get to these meetings. So we do have it recorded available for them to request if needed. Other ways they can get involved and that we uplift the workforce is providing different committees. We do have an advocacy and policy committee that works on all the CHW advocacy stuff and policy measures. We also have a communications and marketing committee that meets and they help us get all the resources out through our social media and make sure our newsletters are relevant to the workforce. And then most of all that's important for us is self-care. Our Hui Kahua committee works on developing activities once a month where CHWs can actually partake in self-care activities. We find that CHWs are constantly pouring out to their community members that they're rarely pouring back into themselves. So very important that we have this community that's uplifting this portion of the work. And then, of course, workforce development, making sure that job opportunities are presented to CHWs and that we have lunch and learn trainings that are developed and that's relevant to the workforce. So the different committees that different CHWs can get involved in and also build their capacity in ways that we uplift the workforce. Other ways that we uplift the workforce is by presenting lunch and learns that we mentioned. These lunch and learns are requested by CHWs. Oftentimes there's so much trainings out there and employers will kind of force feed their CHW the work. But oftentimes CHWs know their boots on the ground and they know the trainings that they need to uplift their communities. So at the end of the year, we'll ask them what they want and our workforce development committee will work together to put on the lunch and learns. Oftentimes it's presented by CHWs. CHWs are experts within the field. So we like to see them building their capacity capacity and having these presentations and actually helping them build the workforce and the capacity. And it also works with the CHW schedules. We also have it recorded and available during their lunchtime as they have requested. Similar to the CHW only meetings, we also record these trainings and have it available. And you can see the most recent we had was around HR1, navigating Medicaid in Hawaii, bridging communities to care in a time of change, where we actually had the MedQuest department come on and talk about some of those changes and how we can get this information into communities as we're the trusted community members that can give this information in a way that they can understand. And similar to that, we had a lunch and learn in regards to connecting Ohana to SNAP benefits and some of the changes that would be impacting the workforce. So as you can see, lots of opportunities for yourselves as partners to really uplift the CHW workforce by participating in lunch and learn or potentially being a presenter. We also have regional meetings. We found that it's very important for us to go to CHWs where they're at so we can see some of the barriers and meet with some of the people and the faces there. Regional meetings are biannually. So in 2027, next year, we'll be traveling to each island, meeting with CHWs, helping to understand what we can help with them to address some of the barriers that they're experiencing communities. Like I mentioned, the purpose is really to allow CHWs to network and collaborate and provide updates locally and also nationally. And of course, share any resources that we could uplift the research uplift the workforce in that regard. Similar to that, we also have our Hawaii CHW conference that Sid mentioned that we just completed back on August 7th. It was the largest CHW gathering within the state of Hawaii. And really our goal is to unite and uplift the voices of CHWs and really honor all of the things that they've done in regards to building resilience in the communities that they're serving. We also show them ways that we're supporting them and strengthening the CHW workforce so they can remain empowered to serve their communities. We had breakout sessions and national speakers, and our closing panel was with MedQuest Meredith, as well as DOH Jordan and myself, really asking CHWs to let's move forward together. So it was a great time, and we look forward to having this conference available for CHWs every other year. Our education campaign continues to grow. We've developed an informational sheet if you're ever interested in receiving this information, just email us. We developed a brochure. Oftentimes you'll see us at health and resource fairs doing presentations. So if you're interested, let us know. And we also help build education with people of power as they're making policies around community health workers. So important that they know the value of community health workers. With these types of education, we also bring that to our policy and advocacy efforts. And every year we visit the state capitol during opening day to really raise awareness of community health workers, because we found a lot of the legislators still don't know who we are. And they find that building a strong relationship with community health workers, they can get a good understanding of their constituents that we're serving. So this has been a great time for us to build that network and build strong, lasting relationships with people of power. And so exciting to see CHWs actually having those conversations, being confident within this realm. Oftentimes, we also push for the CHW Awareness Month proclamation. So like they mentioned, August is CHW Awareness Month here in the state of Hawaii, and we're able to get this proclamation done by the governor for 3 years in a row now, since 2024, 25, and 26. And of course, our local efforts, of course, lead us to our national efforts, where we're able to partner with the National Association of Community Health Workers and Partners in Health with their national efforts around advocacy and policy to help support the CHW Access Act, National CHW Awareness Week, which is the last week of August, and then CHW appropriations. It was a really fulfilling time up there where we were able to build our capacity again as CHW leaders and also build that trusting relationship with our legislators. The bulk of the work really comes down to CHW sustainability. As you folks may know, CHWs are currently chasing grant cycles after grant cycles. Opportunities will come and opportunities will go. And at the end, it's only the community that suffers, right? Community workers want to do the work and they have the heart, but they also need to feed their families. So one of the biggest efforts that we have is around our CHW sustainability project, which really kicked off in 2022. And we continue to build that with reports in 2023, showcasing what CHWs want and really showcasing that it's really going to take a blended funding model around Medicaid, Medicare funding, as well as grants, and really utilizing those funding in a breeding way. 2024, we went up to Washington, Spokane, where we met with national leaders and CHW associations from across the state. We learned about their sustainability plans, what worked and what didn't work, and really brought all of that information back as we kind of work towards our sustainability plan and implementation in 2025. You folks may have also heard of SCR 16 SD1, which asked the Department of Health to convene a task force to talk about minimal professional standards. That took place back in 2025, and we look forward to carrying on that conversation this year. So lots of work being done, and this is some of the ways that the association is uplifting them. Of course, this work could not have been done without our fiscal sponsors, the Hawaii Public Health Institute. So at this time, I'd like to go ahead and hand the presentation over to Rosie to talk a little bit more about the Hawaii Public Health Institution. Thank you, Rosie.
Mahalo, Chauncey. Mahalo, Sid, for sharing. And yeah, quick shout out to, I see a lot of CHWs on the call too. Auntie Ella, we did a spotlight on her and her work, and Miley on the Leadership Council. And April, we just did an interview. You'll see that going out for CHW Awareness Month. So keep an eye out on that. But I know there's probably a lot of folks on the call as well. But yeah, I just wanted to shout you folks out. Really quickly here. But aloha, everyone. My name is Rosie Filemoni, as mentioned. I have the privilege to support the Hawaii Community Health Worker initiatives at Hawaii Public Health Institute. And again, mahalo for inviting us into this space and just to share more of the work that we do. And I want to just share a little bit more about HIFI before I touch on our work specifically as an ally organization to CHWs. But yeah, before Hi-Fi, we were initially known as the Coalition for Tobacco-Free Hawaii. A lot of folks more commonly know us through the Coalition for Tobacco-Free Hawaii. We still do that great work. It's still going around, and that started in 1996. And that was specifically the sole focus of addressing the burden of tobacco-related health concerns. And then it was around 2012 is when we moved from that singular focus on tobacco-specific initiatives to include a broader public health mission. 2017 is specifically when we started working closely with the amazing CHWs throughout Hawaii, throughout the nation, and really just supporting them to strengthen their workforce, but acknowledging that a lot of work has been done and CHWs have been around way before 2017, but that's just when we started supporting CHWs. And then really Hi-Fi, Hawaii Public Health Institute, really kicked off as an organization that it is today through some COVID-19 efforts and really responding to the needs during that time. Overall, our mission is to advance the health and wellness of the people and the islands of Hawaii, and our vision is that all people of Hawaii achieve their best health. Next slide, please. So just to gain a better understanding of the CHW program that we are a part of, we are, I think we're on one more, sorry, one more slide back. Thank you. We are a part of the workforce development profile of Hi-Fi. You can see some of the other profiles on there that include prevention and well-being, community preparedness and resiliency, and of course, research. And so included in our workforce development profile is our CHW initiatives, as well as our Hawaii Public Training Hui, internship and early career opportunities, and the Give Back, Get Back education loan repayment program. So that's just a little bit about our workforce development profile. And so some of our specific CHW initiatives under this workforce development profile is a vast variety of things. So some of these initiatives include sustainability pathways for the CHW profession, which Chauncey had just recently shared about. We also work directly with community health worker allies, and I'll share a little bit more about that work. Help to increase and strengthen the CHW workforce through a deployment model to hire, train, and deploy CHWs for COVID-19 specific efforts and chronic disease conditions as well. I'll also share about that. And then as Chauncey mentioned again, we support the Hawaii Community Health Worker Association directly. We are an umbrella organization for them, as well as kind of that last initiative bubble there, being supporting the CHW workforce specifically through whether it's training, meeting any other additional needs throughout the state. Okay, so focusing on that last bubble that I mentioned, the workforce development initiatives, again, we partner with the association to really listen to what type of trainings that CHWs need. In addition to the launch and learns that Chauncey had mentioned that are typically online, we also work to secure additional funding to provide in-person training and a little more hands-on based on the need. Earlier this year, we had the opportunity to provide chronic disease conditions trainings on diabetes, hypertension, and asthma to CHWs out in Hilo and Kona specifically. And later in October, we'll be heading to Kauai to provide that same training. And through this specific funding, we're able to purchase these booklets on the screen here. So CHWs can utilize them as a tool for communities, while they're doing their outreach or really any other health education opportunities that they have. So this is, again, just providing them that tool that they can utilize when they're also out in the community. And really what we learned from this is that CHWs are sponges, right? They are willing to receive a lot of types of different trainings, and they know the trainings that they need because they work with a vast variety of clients from keiki to kupuna. So, identifying these trainings and working with the CHWs to identify those trainings is really crucial for workforce development initiatives. And as Chauncey mentioned earlier, there are a lot of efforts being worked on for the CHW Sustainability Project. Our role as HICHWA is to secure national and local experts and contract with them to continue this work moving forward, whether it's through response for proposal processes or other solicitations. We work closely with the association to ensure that the work continues to move in the directions that CHWs in Hawaii envision, especially during busy times when CHWs need to maybe focus more on the direct efforts in serving the community. We want to ensure that these things are moving forward. And so here are some reports. We can share this as a PDF as well, and you can click those read report buttons there, and it'll provide you to the direct link to those reports. And some important notes, I know Chauncey also mentioned some of these as well, but just to note that there is no required certification, right, for CHWs here in Hawaii. But as Chauncey mentioned that there are different programs for certificates of competence. But knowing that, like Chauncey mentioned as well, with the task force, there are discussions in creating a voluntary certification process. So that is all being discussed. In discussion as well is plans to develop CHW service to be reimbursed as another sustainability pathway. And just noting that these conversations really just taking time to have these conversations to ensure that CHWs are at the table to provide their mana'o and ensure that no CHW is left behind due to barriers in these specific processes. So we are taking our time on developing these processes. And really the main reason for that is because we've seen in other states where other professions lead the creation of whether it's a licensures or a mandatory certification, and it leads to more harm than good for the CHWs because it wasn't thought of really, or CHWs weren't really involved in that process to really ensure that CHWs aren't harmed or left out in these processes because they were developed by other professions. So that is really important. We really want to iron out these details and really take those necessary steps to have the conversations before moving forward with anything major. Awesome. And yeah, as I mentioned before too, as a collaborative networking and partnership effort, we meet with various allies to support the CHW profession. And just by definition, the National Association of Community Health Workers define allies as medical behavioral health providers, public health professionals, educators, advocates, and so forth. Basically, those who support the CHW workforce but don't necessarily identify as a CHW themselves. So if that's you and you're interested in joining, we do have our quarterly ally meeting and definitely can connect if you're interested in that. But just to share a little bit more about those ally meetings on the next slide, we do meet with a diverse group of allies. I see some allies on the call to shout out to you, Hope. But yeah, we do work with a lot of folks too, whether they're in the academia institutes, insurance companies, medical centers, Native Hawaiian healthcare systems, and more, to really provide that subject matter expert to support and assist the CHWs in achieving what they want. And so now what we're currently working on is developing an employer toolkit. So, stay connected, more details to come if that's something you're interested in. And the last kind of initiative that I'll share today is the 2109 CHW project. The goal for this project was really to highlight the integral roles of CHWs in creating, resilient and response efforts in the hardest hit communities with COVID-19 and then, of course, chronic disease conditions. And our role as HICHWA was to play that key administrative role to address any burden that may come with the hiring process, such as scheduling, interviewing, reference checks, all those things, paperwork, to take that burden off the deployment site, help train the CHWs, then deploy them out to the non-traditional settings. We've seen CHWs in pharmacies, public housing, and so forth, and really just help them to keep engaged with the community throughout their project. And on the next slide, I won't go into too much detail on everything, but I do have the slide here if you want to learn more about the project. One thing that we were really excited about was that 77% of those that were hired on, so HICHWA hired them on, deployed them out to other organizations, and they were a HICHWA employee at the time. So 77% of them, CHWs and bilingual health aides, were offered full-time positions by the deployment sites to stay and continue long after the grant ends. So that was really exciting. And I added the QR code there if you want to listen in to more of that story on this project. But the main reason why I bring this up is actually to showcase the creation of educational resources and the technical assistance that we were able to provide through this project. And so in partnership with the Healthy Hawaii Evaluation Team and of course the Department of Health, we were able to develop these journey maps. And this is just one of the many that we did for each CHW and bilingual health aide to really showcase the journey of what they go through to assist with a client, right? Sid was sharing, like maybe it's sitting down at the table, right? And then it's something else with the other client. But every journey is different, but every journey is so impactful. So this really captured the unique roles of CHWs and really the vital roles that they play within communities and their impact. So this specific journey map was created entitled Connecting Community as CHW Helps His Rural Marshallese Community Gain Access. So in this journey map, you'll meet Taki, who is a bilingual health aide fluent in Marshallese. He works with a very unique community in the rural areas of Hawaii Island and really works to cut down the barriers so that his community can then receive the services in that specific area and really address the needs that they're experiencing. And so throughout his journey, as you may read through, Taki collaborates with other CHWs that were a part of this project. He's speaking with community leaders, whether it's within the church, to not only advertise the event, but also gain approval in order to allow maybe outsiders of the community to come in and provide these services. And without that connection, because Taki is able to speak their language, right? And they look like the community and they have that relationship with the leaders. They were able to grant access to allow some of these services to come into the community. And because of that, a first-time mom was able to get connected with some free diapers and other support services through Healthy Mothers, Healthy Babies. And then they were supported way after this event had ended as well. So those are the unique roles. Those are some of the barriers that maybe we don't think about, but community health workers can have that really impact to bridge that gap and bring services into communities. But yeah, that's a little bit about our journey maps as a tool to help advocate and just, again, build some awareness on the impact of CHWs. So mahalo.
I have never seen so many happy symbols and saying hello to everybody in the chat in any of our behavioral health echoes. So I know that community health workers are happy people and have lots of friends. And we even have um, somebody on the line from Africa. Where did she say she's from? Oh my gosh, let me see. I was like, oh wow, that's so cool. Um, Ethiopia. Um, and we had a couple other comments here. So she says, Tay from Ethiopia, the greatest superpower of a community health worker is unmatched local trust in bold, which allows them to act as a vital bridge between isolated families and the formal healthcare system. Why it works, shared identity. They live in the neighborhoods they serve, speaking the same language and sharing the same cultural background. Overcoming fear. People are far more likely to accept medical advice, vaccines, or screenings when recommended by a familiar neighbor rather than an unfamiliar clinic. The impact translates complex medical guidelines into simple daily habits, catches illnesses and nutritional issues early before they become emergencies, and fights health rumors and misinformation with personal credibility, which is my favorite, which we so need these days. And Randy says we have incredibly compassionate community health workers here at United Healthcare in Hilo. And Ella said it was an excellent conference. And there was one more comment here. Where did it go? Miley says we have a community health worker on Maui who works with Maui Police Department. It's helpful for community health workers to locate houseless members in case they pass and are at the forensic facility. And I know there is a community health, a peer navigator who works with the drug court on Big Island, and that works really well. Um, yeah. So anyway, lots of chat and activity and saying hi to people. So that's super exciting. Any questions? Does anyone have a case?
Yes, that was a fabulous presentation. Thank you folks so much for taking the time.
I have a question, and thank you for that presentation. Are you folks aware of any specific program right now that we could refer folks to in regards to the new Medicaid work requirements coming up? Is there any support or programs out there?
I thank you, Summer, for that question. Not that I know of currently, we have been working very closely with DHS, and they just released a flyer. And we also do have a lunch and learn that has been recorded on our website where community members can get access to some of the new requirements. But we do have that info sheet that will be released in our newsletter. And if you want a copy to circulate amongst your organization, amongst your peers, we can also provide that to you. And we'll be sure to get a PDF copy of our presentation as well. But I'll be sure to send that information over to Kiana to share out with our um, people on the call today.
Great. Mahalo, Chauncey.
Welcome.
We could actually make that into a case. Let's say, oh, okay, I'll present it as a case. I am a community health worker working on Molokai at the community health center there, and I have a patient who will be who lost their job last month, so will be losing their coverage and applying to MedQuest. And they've been anxious because they heard that there was going to be more requirements for to get MedQuest insurance. And so they're worried they're going to go without insurance because they lost their job and haven't been able to find another one. I just created a case out of it, but because we're supposed to be case-based. So, so Ella says they can do volunteer work. That's what I've heard too. And so our next step is to figure out how to, well, I know at the health center on Molokai, I think they have an Aloha Care office too. At least they used to, so they could talk with them and see how it could get, they could stay on insurance. But I don't know if there have been guidelines about how you document the volunteer work because you're supposed to have a certain number of hours per week. So that's something we have to be, ooh, the flyer. That's something we have to be on the lookout for. So in the chat is the one pager on this, January 1st, 2027. So the patient doesn't have to worry yet. And then more information. So household income of less than 580 or more in at least 1 month of the previous 6 months. You have to have one of these to meet the Keep MedQuest coverage, or enrolled half-time in an educational program. Oh, like community health worker. Or work or volunteer at least 80 hours in at least 1 month of the previous 6 months. Oh, that's not as bad as I thought it was going to be. Ooh. Um, okay, so that's really good information. And then working with their local MedQuest office and or health center or community health worker.
I'd love if I can to share one of our speakers, Meredith Nichols with the MedQuest office, had shared in our closing panel at last week Friday's conference, and she had shared one thing that I thought was eye-opening too, that, graduation season, maybe you go play music for graduation party and then you get paid for that. That is something that you can also input as a source of income, just to showcase again. And that's for the household, I believe she was saying. That is something that you can showcase that, hey, you're making the money, you're meeting those requirements as well. So just kind of keeping that in mind too. I think talking stories and trying to figure out and navigate the different scenarios, I think is also really key, because it might not just be like very specific. It has to be a job, or it has to be like this volunteer, or it has to be this, but if you're playing music, or if you're doing some other kind of service and you can count that as some kind of income, that can count as too. And that's straight from that's straight from Meredith herself. So, and we're happy to share her slides as well that she had presented on from our Friday conference too. So just wanted to throw that in there.
Yeah, that's a good idea. Well, we can ask her to speak too. We can say we heard how good she was at the Community Health Worker Conference. And somebody recommended referring her to volunteer organizations. Danette asked, how will that affect patients that live on Molokai in Lanai where there is limited resources? Um, and I think that means like the volunteer resources, but I know there's an AHEC and you can always volunteer with Rosie Davis. Um, yeah, they have community members that need help everywhere. True. Other questions or ideas or cases? This is a brain trust right here. Um, so community resource, we try and share community resources in this meeting so that we all know about them. Mary says, I wonder if at-home volunteer work would count, like phone calls, resource navigation, etc. Ooh, good question. Even home care. A lot of people are doing home care for loved ones. Well, we can ask Meredith Nichols to come talk in December. Good timing, because she'll know. Leslie said, could volunteer with a hospice agency. They have required hours for volunteers. And Ella says they get credit for what Medicare, they get credit for that with Medicare now, I believe. So we have many questions about this.
Wonderful. We'll sure to be connected with Meredith. That sounds like a wonderful presentation for the end of the year. Thank you so much, Rosie, Sid, and Chauncey oh, we have another one right here. Are there any transportation resources that provide bus pass or work rides? That is from
Well,
Lisa.
that's ironic because I know Summer just submitted a grant to get taxi vouchers and bus passes for people to get health care. We don't know if she got it yet, but
Oh, crossing our fingers.
that would be on Big Island, but that would be nice everywhere.
I'm
And Ch
curious. to know for some volunteer agencies or the ones that are known to open up volunteering opportunities, how lengthy the background check or is, because I've been hearing some concern about if you volunteer for different organizations, how that could lag continual 80-hour opportunity in 1 month, and then you'd have to start again the next month.
Ooh. Well, I know how you do a background check in Hawaii, and it's on eCrim and it costs $5. That's for a criminal check, and then yeah, that's a background check. Yeah. So it shouldn't seem like it should take that long, but they would have to do it. Oh, if you go to a different agency every
Yeah,
month.
like different agencies. So I'm wondering if that might be a great thing for an organization to do, just like a HOI that does all background checks. So they don't have to keep doing it